Funding for this program was provided by the Corporation for Public Broadcasting and viewers like you. Thank you.
Thanks for joining us on this special edition of Fronteras, a changing America, building a 21st century workforce. The Bridge of Southern New Mexico coordinated the series, and you will find a lot more information at newmexicotruetalent.org. Today's focus is healthcare. Students in health sciences programs at Doña Ana Community College are studying to become part of an essential but often overlooked portion of the healthcare industry. Michael Hernandez reports.
Healthcare is the fastest growing sector in the United States, and with an aging baby boomer population, the demand for qualified professionals is set to increase sharply. Data from the Bureau of Labor Statistics projects employment of healthcare occupations to grow 18% between 2016 and 2026, adding 2.4 million jobs, more than any other industry in that span. With that in mind, officials from Doña Ana Community College want to remind students doctors and nurses are just part of the workforce. Health Sciences Division Dean Josie Carmona says the healthcare industry requires many other occupations.
Nursing isn't always the only road that students can take, and so we have radiologic technology, we have respiratory therapy, we have diagnostic medical sonography, and so there's always employment opportunities for that. And so our students oftentimes come to us and they're seeking out a nursing field without really understanding that the healthcare industry has an array of opportunities that aren't necessarily linked to nursing.
Take junior Dylan Cordova. Cordova was a nursing major at the University of New Mexico, but after discovering it wasn't the right career fit, he entered the dental hygiene program at DACC. He says it's appealing to work in a preventive care setting where he can practice on his classmates during dental clinics.
There's a lot of salivary glands inside of your mouth, whether that be the lining of your cheek or your tongue, and saliva actually has calcium in it, and calcium mineralizes plaque. So this plaque, once it gets hit with all this calcium from your saliva, is going to harden and then form calculus, which can be kind of like a cemented part on your tooth that just really, really sticks there, and that's really what we're looking for today.
National certifications in the health sciences range from 1 semester to 3 years to earn, with DACC reporting pass rates between 90 and 100% in its programs. Like Cordova, DACC graduate Molly McClure was interested in healthcare, but not as a nurse. McClure is a diagnostic medical sonographer and part-time lab instructor at the college. But McClure says she had no interest in health sciences in high school or college, instead getting her bachelor's degree in engineering.
I worked as an engineer for about 6 years after I got out of college. And then I stayed home for several years, many years, with my kids before I decided that I really needed to join the workforce again. And that was when I started exploring and trying to decide what to do. And at that point, I think maybe as an older adult, the idea of taking care of people a little bit wasn't so daunting, you know. So, so the idea of a medical career appealed to me more, and the technical aspect of sonography still appealed to the engineer in me.
As a sonographer, McClure says there's much more to the job than performing ultrasounds on pregnant women. It also includes scanning abdominal organs like the liver and kidneys, reproductive glands, as well as muscles, tendons, and blood vessels.
You get a really solid academic background, understanding of anatomy and pathology that you can see in that anatomy. You get a good understanding of the technical aspects of what you're doing with the sonography machine. You have coursework related to patient care. You learn what you're going to be dealing with when it comes to patients, because there's a pretty wide variety of patients out there. And then you get a lot of clinical time where you're out there practicing on real people.
Program officials say those opportunities to gain hands-on skills are the goal. Virginia Durant heads the school's respiratory therapy program and says her students administer everything from CPR to breathing treatments and work with patients in critical care units.
Apply pads to patient's bare chest. Deliver shock now. Shock delivered.
One thing we want them to know when I advise them coming in that they're going to see lots of death. And then we also, in our profession, we're the ones that disconnect them from life support. So it's important that they understand that. They understand that they have to take blood. It's not from the veins, it's from the arteries. And then we deal with lots of sputum, anything from the chest up. So they have to suction the patients and be used to things like that.
Along with education, Durant says she hopes students take away a passion for caring for patients once they graduate.
It's not about the money, it's just being able to help a patient. We lose some, so we help them cope with that and how to understand it's an honor to be there. And then some they can really save and do well, and it's exciting to see a patient leave the hospital and do well.
Whichever program students may choose, each career helps contribute to a patient's well-being. And for employees, financial well-being is a major benefit. The Bureau of Labor Statistics reports the median annual wage for healthcare practitioners and technical occupations was nearly $65,000 in May 2017. That's dramatically higher than the median annual wage for all occupations, less than $38,000. For KRWG Public Media, I'm Michael Hernandez.
Some examples there of building the healthcare workforce in our community. We continue our discussion with Melanie Fatuzzi of Mountain View Regional Medical Center. We also have with us Sabrina Martin from the Rehabilitation Hospital of Southern New Mexico and Joni Anderson, Las Cruces High School Healthcare Career and Technical Education teacher. Our panel was coordinated by the Bridge of Southern New Mexico, and you can find more information at newmexicotruetalent.org. It is a wealth of information, and I'm so pleased to have all three of you here to talk with us today. Thank you for being here.
Thank you. Thank you for having us.
All right, Melanie, we'll begin with you. As one of the largest healthcare providers actually in our community, there are many different jobs represented. We got a little taste of that in the report we just saw. Can you talk about the workforce challenges in the healthcare industry in our region and across the state?
Yes, Fred, thank you so much for having us. And it is a challenge, and I love that they showed that clip just so that people can have a deeper understanding, especially the respiratory therapist. It's here in our community, we have a shortage. When they graduate from DACC, they have jobs immediately to the point that we can't even fill all of our openings. So then we have to reach throughout the state into other cities to relocate to this area. So if it's something that you saw and you're interested in, there is that real opportunity. Sonography also, another big need in this community. They have offers before they even graduate. And I don't think that people really understand that healthcare is so widespread. At Mountain View, we employ 1,500 people, which is a big portion of, I think, about 1% of our city, which is large for one employer. And we're like our own little city. And I mean, even as far as like if accounting is your passion, look at hospitals and stuff like that. It is billing, coding. There are so many other things other than if you're like, oh, I just can't do patient care. I work in human resources, so that's an opportunity as well. But across the state, we're very rural, so there is that challenge. And there's lots of opportunities to get your education paid for through rural healthcare and through at Mountain View. We have people who come in as CNA, Certified Nursing Assistant, CMA, Certified Medical Assistant, more of an entry-level position. Some people do use it as a career and they're so needed. We have, I think, about 20 openings for CMAs right now. And they don't think to look to Mountain View as an employer, and they don't know that that is a career that they can choose that is a very good opportunity for them in healthcare and a stepping stone. Because once you're in Mountain View and other major employers, they do help with education if you want to keep moving up. The most progressive entry level to, I would say, upper level is central sterile techs. That's the ones who clean the instruments for the surgeon. And at Mountain View, we'll start there, and then they can go to be an OR tech, and then maybe they want to go into nursing. And so there's so many things that you can get into healthcare and really build your life around and the possibilities are endless. I've seen, I think our CEO currently, he started in housekeeping, and now he's the CEO of our hospital, and he was an OR tech.
What a great example, you know, and it is an underreported story that even during our recession, one of the worst recessions in the history of the country, healthcare continued to add jobs, and wages in healthcare continued to go up. It's supply and demand, and this is something, it's one of the reasons I loved economics. I mean, I could understand that pretty easily.
Right.
And it's so important when people are thinking about a career for many people. Sabrina, you know, I want to talk with you about this too. You know, I know you're a member of the Greater Las Cruces Chamber of Commerce, their healthcare committee. Tell me your view and what you're hearing about the key discussions that are really being held about workforce challenges, particularly for small and mid-sized healthcare providers as well.
Absolutely. So we do at the Greater Las Cruces Chamber of Commerce represent various healthcare businesses in town, from the big hospitals all the way down to some small private home care providers to dental offices. And so this is one of our main discussion points every month. And we talk both about the quantity and the quality of the healthcare workforce. And with the quantity discussion, as the video showed, as is pretty common knowledge, there's a shortage. And we work on how we can have a private-public partnership to help produce the healthcare workforce that our community needs. We've worked closely with NMSU and DACC to see if there's ways that we could expand on their programs, increase the number of graduates. And so that's a constant conversation, so that we're all not struggling and feeling, and especially recruiting from outside of our community, or potentially having, you know, contract labor, which is basically traveling employees. It really decreases the quality of care and the closeness to our own community. As far as the quality side of things, you know, we find that one of the most important aspects is kindness and compassion, and finding and going into healthcare for the right reasons, whether it is at the bedside, or as Melanie said, if you don't have the stomach or the desire to be at the bedside, still that desire to touch patients in a different way, that might be through dietary services and or environmental services.
All the more reason to get a touch of this when you're still getting your education, to see, is this the right thing for me?
Absolutely.
That moves me to you, Joni, about this very issue. Tell me about the importance of a career and technical education courses and their importance for those who might be thinking, I think I might want to pursue a career in healthcare. Well,
as a CTE teacher, they all come in as freshmen. They want to be pediatric neurosurgeons, and it's our job at the high school. We put in a pre-nursing pathway as well as Project Lead the Way biomedical science pathway, and during our courses we teach them about all the different possibilities out there. And I think taking CTE courses in high school for those students is really important, because it's not about we want to be this, it's about what don't you want to be, because somebody who wants to be a surgeon can't dissect whatever we're doing that day, and it's eye-opening to them for sure.
I just think this is amazing, and you're a great champion to do this work. You know, when I think about it being in high school, the opportunities that some of these young people have now, it's just amazing. I mean, especially like the early college high school, where you can get an associate's degree in high school, and then you have 2 more years when you get out for a bachelor's degree. It's amazing. Melanie, give me a sense that after they get that education, a little more about the career opportunities. You talked about this in the Mountain View system, that there's a great diversity. And I get the sense that there needs to be more education about this, that people need to understand that you automatically think of nurses and doctors, but you may not think of all of the other different positions there are in healthcare.
Right, that's a great question. I'm glad you asked. Like, there's accounting, there's plant ops. I mean, we have plumbers, we have air conditioners. if you could think of it, we probably employ somebody in that position. And it's so widespread, and they don't think of looking in the healthcare. Billing and coding, I think there's a big shortage there as well.
Yeah.
And for
so
some,
it even goes outside of the healthcare. It is in healthcare, but
right.
it is an administrative position or an office position.
And
right?
so, and like billing and coding, you can even do from home. So if you have young children or you're thinking about starting your family, it is a great career opportunity in healthcare, like you said, rising wages as opposed to competitive where everyone's fighting for a job. We're fighting to find people who are qualified.
Okay, and that comes to you, Sabrina. Tell me about how you work in partnership with high schools, community college, university, all the different educational institutions to help prepare future talent.
At the rehab hospital, we work at every level. From the high school, this summer we had a couple great groups of students from the TRIO Upward Bound program that I know Las Cruces Public Schools and Gadsden promote that. And so that's where we are getting those students that might not be in a program and are fortunate to have somebody like Joni, but we can expose them to all these. We give them tours. We have the different people from the different areas of the facility sit and talk to them about careers. It's almost a full day thing of question and answer. And so really any exposure we can. And then of course we work closely with DACC, NMSU, other programs for student affiliations, for volunteer hours, for observation, anything we can do, all the way up to the BCom students come in their first year and expose them to what all the professions do, not just what medical students do.
Yeah.
So and as the Greater Chamber Healthcare Committee, I think all the businesses are committed to being available at all those levels to increase interest in the healthcare workforce.
Okay. Joni, give us a sense of when the students do get into a CTE program, the kind of head start that they get to get into the workforce.
So a good CTE program should have the courses. We have anatomy and physiology, we have medical terminology, we have principles of biomedical science, healthcare occupations. In addition to those courses, though, CTE programs should have some kind of career technical student organization. And that's the leadership piece. For the healthcare, what we have presently is something called HOSA, Future Health Professionals. That develops their leadership skills. It helps them network. We take them to Florida to compete. We take them to California to compete. And it's really important to have that piece, because those skills that they don't necessarily get until they get out into the workforce, we're exposing them now.
Yeah.
The third thing that you need is work-based experience. And we have our kids in something called ACEs, which they go out and serve a half day every day for a semester or 2 semesters. And then in the Project Lead the Way pathway, I have kids stationed in the biochemistry labs getting some lab experience. So those 3 things, it can't just be the course, it needs to be the work-based experience as well as the leadership development.
Yeah, such an amazing opportunity. CTE gives students such a head start. We've seen that in so many different professions. Melanie, what are some other things for someone who's watching this, or a parent who's watching this and may think that their child might want to pursue a healthcare career, or maybe there's even someone watching who may want to do a career switch into healthcare. We hear about that a lot. What other things could they do to prepare themselves?
Volunteering. I have found so many career changes in my life through volunteering. And it's a little bit harder when you're under 18, but once you start reaching that, and those programs like she was speaking of, we do have students that come in through the school programs and they're able to get that exposure. But once you're old enough, or there are other opportunities, just getting in the facility to see what's there. So many times we hire people, they're like, you know what, I started out with this and now I'm that. And we have a lab and our medical technicians, and they do all that chemistry and all that stuff, and it's like some people no interest, other people a lot. But the more you can enrich your life through volunteering and just make those connections and network and talk to people, it will open so many doors. I know that almost everyone on our staff, if you just find yourself at Mountain View and you ask them, how did you get into that profession? people are more than willing to share their story, and it really opens your eyes to the possibilities of where people came from and what they were able to achieve. And so much of it is just attitude. I believe whoever's listening to this program today that they're meant to be here, and that if you have a great attitude and you surround yourself with the right people, you could have an amazing career in healthcare.
Okay, Sabrina, in your view, how young should we be exposing students to the kind of variety of careers in healthcare they might enjoy?
I think exposure can begin as young as middle school, but definitely high school. A lot of it depends very much on maturity levels. There are some people that, until you get a little bit more mature, aren't ready to be exposed to too much of the healthcare, the bedside part of healthcare, but just open to the careers, open to the possibilities, open to the variety, as Melanie has talked about several times, that it's not just nursing, as was said in the video also. And so, while you might not be at the bedside volunteering, the exposure to the careers, I think, is the most important thing. So it helps you start off college going in the right direction, and you don't spend too many years going down the wrong road.
And Joni, of course, not everyone enters college right away or ever enters college, but one of the things that's so important to emphasize with CTE is that career certifications can be earned by students while they're in high school or shortly thereafter. Let's talk about that.
Sure. So we try to make sure that our freshmen and sophomores have the opportunity to get their Heart Saver CPR first aid certification. And then as they become juniors and seniors, we offer the opportunity for them to get their basic life support certification, which most healthcare places require. As far as talking about exposing them to careers, HOSA has 52 different competitions, EMT, CNA, medical assisting, all these things that we've been discussing. They do those, and even though there's not a certification with it necessarily, they're exposed to the skills that each of those things require. Arrowhead does have a class that our kids can earn their CNA certification through, as well as EKG.
Okay, and if folks are just joining us now, at the early college, high school, Arrowhead, as you mentioned, young people in our community who enter that early college, high school can get an associate's degree while in high school. So you graduate high school, you get the high school diploma, but you also get an associate's degree. And I'm sure you run into this. Many folks don't realize that you can be a registered nurse with an associate's degree. You have to pass, of course, the boards, but once you do, talk about a job that is so important and in such high demand. There also are many other fields as well that fall in that as well. Melanie, are there any other challenges we haven't talked about in terms of recruiting and attracting the workforce that you need at Mountain View?
Just the shortage of qualified applicants. And we're very sensitive to the fact that you have to have your first day before you can have your best day, and we are big advocates for new grads. So students coming out of high school with their CNA, absolutely welcome to their new grad nurses, new grad medical technicians, new grad OR techs. New grads are very welcome in our facility. And we want to be that training ground to help you grow, because we want our talent to stay here in our community, that you don't have to go look somewhere else. But it is a struggle that to one, get the information out there that there is an opportunity for you right here in our community in many different healthcare settings, that whatever you're looking for in healthcare is right here locally, that there's no reason to look anywhere else, and that you just have to seek it. And there's people, lots of educators along the way to guide you in that direction, and that once you're inside the walls of an institution like Mountain View, that we will help get you to the next level.
Sabrina, we're quickly running out of time, but you mentioned something earlier that I know is not just a challenge in healthcare, it's in many different industries, the so-called soft skills. Anything else you want to talk about that in terms of what needs to be done in that area?
I think absolutely. Again, it goes back to the reason that you're in that position, and very few positions, whether they're at the office or the bedside in healthcare, don't deal with people. So you need to be a people person. And I think that's a big part when you're dealing with people who are going through life-changing events and might be, on a bed that not being able to move. You need to be able to relate to them. You need to be comfortable with that, and that's it's a very hard thing to teach. So finding that right fit before you get into the program is very important.
Okay, and Joni, what would you say you need from the healthcare industry to better prepare students for the workforce?
Well, I am an educator, and I can read and I can figure things out as I go, but I don't have the expertise that you guys could offer. I need coaches. We need experts to come into the classroom and show us how to do it exactly so I can carry on with what I'm teaching it. We figure it out somewhat, but I'm sure I'm not an expert.
Yeah, and I bet internships too, where appropriate.
Absolutely.
I mean, we have, another thing that not everyone knows about. Las Cruces Public Schools has a program called the Excel program, where students have this opportunity, very significant time, while in high school to do an internship. I know this because we've benefited from this at KRWG Public Media, where we've had amazing high school students who've interned with us. They help us, we help them, and again, incredible opportunities. Well, I know with our short time we've just had a chance to touch the surface, but I appreciate all three of you coming in today to help us with that and help our community learn more about this very important topic.
Absolutely.
Thank you so much. Thank you to everyone at home as well for joining us for this Fronteras special, Building a 21st Century Workforce. That is our program on healthcare, but there is a lot more information for you online. Check out the Bridge of Southern New Mexico at newmexicotruetalent.org. Have a great week.
Funding for this program was provided by the Corporation for Public Broadcasting and viewers like you. Thank you.